testimonial with it about medication. The question is, do you support Medicare and other insurers adding medical marijuana and CBD to their formularies? This person has spent $700 a month for these medications because they're not on a formulary after 30 years on opiates. So, you know, the problem is out there and it's here. So will you answer the question about adding or attempting to add the medical marijuana products to formularies? Is there something you can do? You could start with Sue and go this way this time.
Yes, I do support this. And again, as an emergency room nurse, I have seen firsthand how helpful these medications really can be for patients, especially those that suffer from degenerative neurological diseases, cancer, and many other illnesses. They are helpful. The key is that we have to be willing to fund the research so that we have the data that proves how helpful these medications are for these patients. And I cannot sit on the sidelines and watch people suffer that can be helped with them. So again, we need more funding for research.
Yes, I fully support. I think that we as Americans need to stop demonizing cannabis. It is proven. We have seen the proof that it does help. And so I absolutely fully support.
Yeah, it's common sense. There's science behind it. Unfortunately, with the political leadership that we have now, it's not going to happen, right? We have an attorney general in the form of Jeff Sessions who equates marijuana with heroin, right? He thinks, it's not a joke, he thinks the two things are equivalent. And as long as we have a political leadership that does that, we're not actually focused on the sorts of science that make sure people get all the care that they need. Ultimately, that's why we got to win back seats like this one in order to make sure that we have a congressional-led action to make sure that Medicare actually can accept things like marijuana, which many people I know rely on.
Yeah, absolutely. CBDs and THCs should be added to the formulating with regard to the prescription drugs. Of course, here in California, it's legal now, but then you're going outside of your your healthcare provider's prescription, so you have to be careful with that. But absolutely, all the study shows, and anecdotally, my mom had a really rare autoimmune disorder that had to be treated with Cytoxin, a really strong chemotherapy, and the only relief that she could get was with edible CBDs and THC. So in my own home, I've seen it work, and what doesn't work is our country being flooded with opioids. That's why Sessions probably equates it to heroin, because that's the big drug companies are funding their campaigns, and that's why there are so many opiates on the street right now, is because you have to follow the money. There's too much money in opiates to make our problem go away. So we do need to make changes.
Yes. Next question.
Okay.